And to those who have just joined, I'm Peter Tabbins. I'm the MPP for Toronto-Danforth. I'll be hosting this evening's webinar. Okay, so good evening, everyone. I'm going to start in now. I know that others will continue to join us, but I want to welcome you all to our webinar, our town hall on the privatization of the healthcare system. I've got 4 very strong panelists this evening, and I'm looking forward to the discussion. Over the last week, we've been hearing from hundreds of my constituents by phone, by email, about their shock, their distress about the proposed legislation, the one you've heard of, Bill 7, that will allow the government to coerce disabled and elderly people who are in hospital beds, coerce them into going into a long-term care facility that is not of their choice. And frankly, at the same time, the government has been fast-tracking the bill, I think in part because it has had such a poor reception that they just want to stop being under fire. We tried yesterday, yesterday we held an emergency public hearing, which gave health advocates, seniors advocates, disabled advocates an opportunity to voice their concerns. The meeting was recorded. It's available on my Facebook page, also on my website. And in a few minutes, we'll hear from our panel of experts and give you a chance to express your concerns, put your questions. I want to note this evening that Councillor Paula Fletcher has joined us. Welcome, Councillor Fletcher. I know you have a big interest in this issue, and I hope that you find the whole session worthwhile. I'm sure you will, actually. For those of you who are participants out there, if you want to pose questions, please use the question and answer function. We won't use the raised hand feature or the chat. So if you have a comment, a question you want to put forward, use the Q&A function. Our agenda is very straightforward. I'll be introducing our panelists. Each panelist will have 5 minutes to speak. Then we'll have questions and commentary by you, the participants, and then we'll have closing comments and information by the panelists. And that should be a pretty full evening. So I'll go through the panelists. I want to note here is MPP Gelinas. She's a member of provincial parliament for the riding of Nickel Belt. She's a healthcare professional, community leader, and the healthcare critic for the official opposition of Ontario. Dr. Danyaal Raza, Dan, is past board chair of Canadian Doctors for Medicare. Additionally, he's an assistant professor at the University of Toronto. We have Dr. Kate Dupuis, clinical psychologist, innovation leader in arts and aging at the Centre for Elder Research at Sheridan College, and a proud East Toronto resident. And last and certainly not least, DJ Sanderson, registered nurse and Region 3 Vice President, the Ontario Nurses Association. I should, before we go any further, give our land acknowledgement. We acknowledge we're hosted on the lands of the Mississaugas of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and the Inuit people. And I want to note that land acknowledgement is not enough for reconciliation. Our society needs to take concrete steps to address the damage that's been done to First Nations who were here before all the rest of us arrived. And with that, I am going to go to our panelists' comments. Gelinas, I'd like you to start off, if you could, talking about Bill 7 and the drive to privatize healthcare delivery in Ontario. France?
Thank you so much, Peter. And as it was mentioned, my name is Gelinas. I'm the MPP for Nickel Belt, the big riding in Northeastern Ontario. And for the last 15 years, I have been the health critic for my party, the NDP. So tonight, we're going to talk about privatization. Let me set things straight. In Canada, one of the programs that defines us as Canadian, as Ontarian, is Medicare. Tommy Douglas brought us Medicare, where the care you receive is based on your needs, not on your ability to pay. This is a program that defines us from our friends and neighbors to the south. We are Canadian, we get care based on needs. This care is paid for with public money, so it's publicly paid for, and it is publicly delivered. So not for profit, publicly delivered. Unfortunately, the last conservative government that was there decided that the private sector did things better. So we were facing a few challenges in home care at the time. And if those of you who remember Mike Harris will remember the slogan, the private sectors do things better, faster, cheaper. They tried anyway to convince us that privatizing our home care system would bring us care better, faster, cheaper. Fast forward to 2022, would anybody say that our home care system is better? Absolutely not. Our home care system fails more people than it helps every single day. And a lot of frail elderly people who could be respected, who could be supported at home with a good home care system, end up in trouble. The PSW doesn't come for 2-3 days in a row. They end up in trouble. They end up in the hospital. And then their physicians say, it's not safe for me to send you back home. The home care system will fail you again. So they want to protect their patients. They want to make the best decision. And they put them on the list for a long-term care bed. Bring back to Mike Harris. Mike Harris is also the one who privatized our long-term care system. Ontario is the only province in Canada where privatizations of long-term care has reached. We have more beds that belong to the private for-profit than any other province. We have more homes that belongs to the for-profit. After what we've seen in the pandemic, would anybody say that the care in the for-profit long-term care home is better than the care in a not-for-profit, in a home for the aged? Absolutely not. I mean, the statistics spoke for themselves. There were twice the rates of deaths in private for-profit long-term care home. There were 4 times the rate of if you lived in the long-term care, in a private for-profit long-term care home versus in a home for the aged, 4 times the number of deaths, proportionally to the number of beds. We know that when healthcare is delivered by for-profit company, the number one goal is to make money. The healthcare budget in Ontario is close to $74 billion. A lot of people is attracted to the healthcare system, not because they want to help people, because they want to make money. Now we have our Premier Ford, who's decided that privatizing home care and long-term care was not enough. He now wants to privatize surgery, using the surgical backlog as his reason to privatize surgery when we have lots of empty capacity in our hospital. Every hospital in Ontario have OR rooms sitting empty. They don't have the staff, they don't have the resources, but they certainly, it's not by taking physicians and taking nurses away from those public hospitals and putting them into private surgical suite that we are going to solve the problem. I could go on and on. I was told to only speak for 5 minutes. 30 seconds on Bill 7, the idea that we will force frail elderly people into a long-term care home, not of their choosing. We will take away their right to consent to be assessed, their right to consent to share their personal health information with people is just horrible. And they will vote it through tomorrow without giving anybody an opportunity to talk about it, to make changes, to do anything. Privatization has to be stopped, and I will stop there.
Okay. Franz, thank you very much. It's an excellent opener to all of this. Dr. Raza, could you talk about the need to push back on privatization and what it means for our healthcare system?
Yes, and Peter, thanks so much for the invitation to speak tonight. You know, I think for a long time, even before the pandemic, we've known that the status quo in the system, it was unacceptable. We've had, our system has done many things very well, but there are things that we certainly have needed to do better. Things like making sure everyone in Ontario has access to a family doctor or nurse practitioners, dealing with, even before the pandemic, backlogs in elective surgery. And, you know, it's a cliche at this point that the pandemic really highlighted all the gaps, not just in healthcare, but in many of our social care systems. The gaps where services fell short. But I think the silver lining is it also, especially early in the pandemic, really highlighted what we are capable of. So if people will remember, in the summer and the fall of 2020, our healthcare leaders came together and coordinated care in incredible ways. We're transferring patients from ICU across the provinces, even between provinces. We were creating capacity within the system because it was an urgent demand. You know, I don't recall, and many of my colleagues who are senior to me have never recalled that sort of coordination before. It shows the power of a public system. And then the other thing that we really benefited from was the fact that when you go to an emergency department, you're not paying with your credit card. And it's a challenge that many patients who didn't have insurance in the US faced during the pandemic. And it was one of the reasons why we had there were many reasons, and it was one of the reasons why we had better outcomes. So I think the challenge before us now, right, with the crisis at an entirely new scale, is how do we build on those strengths to make the system better? And I think it's particularly important to move forward with that message now, because for too long, whenever we've talked about the healthcare system, we've ceded reform to the other side, to folks who have been pushing for more private financing or for-profit care, where they've seized the mantle of change and they've said, if you want a better healthcare system, we need to privatize it. Everyone who believes in Medicare is just defenders of the status quo. So I think on one hand, we must stand up for the principles upon which our healthcare system and Medicare is based. But while we're playing defense, I think we also have to play aggressive offense, right? And to propose solutions to make the system better. So in that spirit of playing offense and defense, I think some of the things that we need to play offense on are things like building on our ability to coordinate resources across the system. There's these very innovative models around elective surgery care called single entry referrals or centralized referral models that I'm happy to speak to later. We need to respect healthcare workers, especially our nurses, and I'm glad DJ is here to speak more to that and lift the pay caps imposed by Bill 124. We need to invest in care for older adults, including home care and a not-for-profit long-term care system. And, you know, Medicare only really covers doctors and hospitals. We need to take leadership in not just supporting a federal pharmacare program and a dental care program, but also understanding what's our plan B if the federal government doesn't follow through on their commitments. So that's kind of the offense part. And of course, the defense part, you know, now is an important time to do that piece as well. Oftentimes when we talk about privatization, we can either mean financing. So who's paying for it, right? Is it public funding or is it private funding? In other words, are people paying out of pocket or through private insurance? And, you know, when it comes to doctors or hospitals, overwhelmingly publicly funded. But of course, we know for things like mental health, for dental care, for pharmacare, we have a two-tier US style system. But the thin edge of the wedge, I think, is what we're seeing right now from the Ford government, and that's taking public dollars and contracting them out to for-profit clinics. And I think we need to be worried about this. If you actually look at what the published literature, what peer-reviewed evidence says on this, we actually have a very strong basis for not-for-profit care. So for example, there have been large studies that have compared for-profit hospitals and for-profit dialysis centers in the US compared to not-for-profit hospitals. And the not-for-profit hospitals have lower mortality and better outcomes, as do the dialysis centers. The National Health Service is the name for the health service in the United Kingdom. 10 years ago, they engaged in a scheme to contract out to for-profit providers many of their health services. And there was a study in a very prestigious medical journal called The Lancet that came out, and it demonstrated that mortality, so death rates, actually went up with this contracting out scheme. And of course, everyone is familiar at this point with the absolutely devastating impact that we saw in long-term care that was predominantly focused in for-profit, but especially chain and financialized long-term care centers. So that's what I think we really have to do. We have to focus on standing up for our principles, but then also playing aggressive offense to put out a vision for what Medicare 2.0, what Tommy Douglas's second vision or second phase of Medicare might look like.
Okay. Dr. Raza, thank you very much. That was a very good explanation of what we're dealing with and setting course for going forward. On to Dr. Kate Dupuis, talking about seniors research, long-term care, and how the solution, quote unquote, solution the government's put forward can't actually solve the hospital crisis. Kate, floor's yours.
Thank you so much for having me, Peter. And it's really wonderful that we're doing something at least about this, coming together to speak with so many folks from the community. So my own personal area of expertise, I'm a clinical neuropsychologist who specializes in working with older adults. And I've become very concerned about Bill 7, as France gave a good description of. This is a bill that does not appear to have gone through any sort of public consultation. The Premier today said that he has consulted with CEOs. But what we need is we really need to make sure that we're providing care for folks who are actually in the system, end users, care partners, family, friends. Now, those folks who go into long-term care, this is not typically a decision that families take lightly. These are individuals who require quite an extensive level of care. There's a decision tree that is made in order for folks to go into long-term care. And I understand the framing of this conversation is very interesting to look at, because what the argument seems to be is that, well, we can't have people, unfortunately, the word that was used earlier today in Queen's Park was clogging up the system, taking up these beds. We've heard the term bed blockers being used, which is horrifying. These are individuals who deserve the best quality of care we can provide. No one wants to be in this alternate level of care bed. Folks want to be at home. They want to be in a space where they are receiving not only excellent medical care, but the other thing, of course, to think about is that through our Long-Term Care Act, long-term care homes must also provide a whole host of other types of care. It's a more holistic approach, right? So of course, our personal care is taken care of, but we also have folks who are providing recreation, spiritual care, kinesiology, all sorts of other opportunities for folks to really get a more person-centered approach to care. So I understand from an objective perspective, we don't want folks staying in the homes. Is Bill 7 the way that we approach this? No. People should be going, if they do need care, the first option should always be one's home, right? If you look at research, when we poll people and say, where do you want to age? People will overwhelmingly, 90%, 100% of people age 65 plus say, I want to be at home. So why are we not supporting folks to return home from hospital? Once you've been in hospital for a long time, you may have some deterioration. Perhaps older adults are extremely susceptible to delirium. Maybe there are some medical things that maybe you'll need a little bit more support. Let's bring you home with home care. That is not on the table for some reason at this time. And if you must be going to a long-term care home, it must be in a place that is close to your own community or the community of your, what we call informal care partners, friends, family, neighbors. We know during COVID-19 that the primary focus in long-term care, of course, was on more of the physical well-being of older adults, trying to protect them from the virus. But what we also saw is that the social isolation. So when homes are in outbreak and residents are alone in their room, the social isolation was crushing. And so my concern is that Bill 7, which potentially could allow folks to be sent 30, 100, 300 kilometers away from their homes, will take individuals far from the support that they need from their loved ones. And especially for individuals living with dementia, some of the research I've done during the pandemic suggests, what we're doing here works well for many of us. We can connect over Zoom. This doesn't always work for older individuals, especially those living with dementia. We know that over 60% of folks living in long-term care in Ontario are living with some sort of cognitive impairment. This type of Zoom, this requires a lot of effort. It requires an iPad, it requires a staff member. Not every home is able to provide that. Some of the work I did during the pandemic showed that the moral distress and moral injury for some of the folks working in the long-term care space was because they simply didn't have enough hours in the day to connect residents with their loved ones. So, I also suspect this bill will be pushed through. I think as much as possible, those of you who are on the call, if you are not from Beaches East York or Toronto-Danforth or some of the Nickel Belt, please reach out to your MPP if it is an MPP from the Conservative government. And just, we all deserve to age in place with dignity in a place of our choosing. And I think this may be taken away from some folks here in our province, and that's very worrisome for me.
Okay. Kate, thank you very much. I appreciate that analysis. Our last panelist then, DJ Sanderson. I'm going to turn it over to you to give a perspective from the front lines as to what's going on in hospitals and what needs to go on.
Great, thank you. I'm a proud registered nurse. I'm also the regional vice president for the Ontario Nurses Association, and we represent over 68,000 nurses and healthcare professionals and over 18,000 nursing students working across all sectors of healthcare. First, I want to thank MPP Peter Tabuns for bringing us together tonight on this important conversation about our public healthcare system. Peter, and you as well, France, you've been asking tough questions at Queen's Park and standing up for nurses and healthcare professionals. We see that, and we are very thankful for it. We all know that Ontario is in a healthcare crisis that is putting patient care at risk day in, day out because of a lack of nurses and healthcare professionals to provide this sort of care that they need. I want to share some of the experiences from our frontline nurses and what the toll has been on them as they've been working tirelessly through this global pandemic under the weight of Bill 124. 3 years after the demoralizing, disrespectful pay cut put through as Bill 124, it is clear that the impact has been on a healthcare system that has been hollowed out while nurses and healthcare professionals have been stretched beyond capacity. Just this week, I had the opportunity to speak with a number of my ONA members at Michael Garron Hospital, and they tell me a number of horrifying scenarios. In the labor and delivery department, nurses have been pleading for months on end and putting through written complaints of workload concerns and the ability or the inability of them to maintain their professional standards, which is becoming near impossible. And this is a very busy labor and delivery unit. In the medicine program, they are struggling day in and day out to find qualified staff to operate the unit safely and take care of the acutely ill patients that they've been assigned. Of course, this causes a greater backlog in their busy emergency department as patients aren't able to be admitted to this medicine program. Michael Garron is not like other hospitals in the province. They are facing incredible shortages of critically care trained nurses and mounting vacancies that are throughout the entire facility. Nurses and healthcare professionals continue to leave the professions because of the concerns, not just that I listed above, but because of Bill 124 and the unprecedented levels of violence and harassment they face every single day on the job. These stories show why ONA is calling on the government to take immediate steps to keep the nurses we have, bring back the nurses who have left their jobs, and bring on board new nurses to help shore up the system. We simply cannot afford to have private nursing agency pulling experienced nurses away from the public system for the hopes of a few more dollars or the flexibility that an adequate staff system would afford to them and provide. It starts right away with repealing Bill 124 so that nurses can be compensated fairly. We need to bring back recently retired nurses to mentor these new graduates and internationally trained nurses who are trying to begin a career and start a life here in Ontario. We need to end the reliance on part-time work and create more full-time roles so that nurses don't have to work 2 or 3 jobs in hospitals or throughout long-term care. We need to have this workforce in place to provide the continuity of care to our patients. Now, this concept of continuity of care to patients, this is a huge issue in the long-term care sector. because it provides far more than just the nursing care that these residents require. It builds an environment that provides trust, so that the resident and the care provider work together on meeting the needs of the patient. Private nursing agencies may provide physical staff on a shift-to-shift basis, but oftentimes they're unable to complete all aspects of the job because they simply aren't adequately trained and they don't receive an orientation program that full-time employment provides. Right now, there are ERs closing. ICUs are at capacity. This is simply unsustainable. Lord knows what we're going to face in the fall as our kids return back to school. But this situation did not happen overnight. It's the result of years of underinvestment, understaffing, and underfunding. We know there's solutions that are possible. And we know that privatizing our healthcare system is not the solution. The Ford government is heading in the wrong direction. They're looking at our healthcare crisis as a chance to turn Ontario's public healthcare system over to private businesses, which, as France noted at the start of our thing, they're only in it for the profit. Just look at what they've been doing to long-term care recently, trying to force patients waiting for the right long-term care bed into a for-profit homes that they didn't choose. And in turn, filling the pockets of some of the long-term care for-profit care providers. This has to end. At ONA, we are urging the government to listen to nurses who have the solutions and to take meaningful action to ensure there's a strong public healthcare system that's ready and available to treat the concerns of every single Ontarian. Thank you.
Okay, DJ, thanks very much. Really appreciate that perspective. Folks, I'm going to go to questions and comments. And this first one, France and Dan, I'm going to ask both of you to address it because I think you'll come out from different directions. Is Bill 7, and Bill 7 is the piece of legislation we're dealing with right now that allows the coercion of seniors and the disabled, allows the coercion to get them out of their beds in a hospital and into a long-term care facility that they don't want to go to. Is Bill 7 not a violation of the Canada Health Act, which Ontario must follow? And how do we work with the federal government to address this harmful abuse of our elders?
Do I go first or Dan first?
You might as well go first because you're not muted, France.
Okay, is it a violation of the Canada Health Act? Most of the focus of the Canada Health Act has to do with how the money is used. With Bill 7, it doesn't have as much to do with money as it has to do with taking away the right of frail elderly people to consent to being assessed, to consent to have their personal health information shared, to consent to be moved to a long-term care home of their choice. So I don't know. It is not obvious to me how it would be linked, but there are people who know this way better than I do. So I will pass it on to Dr. Raza.
Thanks, France. Thanks, Peter, and thanks for the question. Let's take a step back and actually just very briefly talk about what exactly does the Canada Health Act cover and what is it? Essentially, it's an agreement between the federal government and the provinces for the federal government to kick in a portion of funding. It used to be 50%. It's since declined, and depending on who you ask, you'll get a different figure. But it's definitely less than when Medicare came to be in the 70s. So it's an agreement for the provinces to receive money to help finance or pay for only two things: care that's done in hospitals and physician care. And the provinces must meet a certain set of conditions in order to receive this money from the federal government. And those conditions are basically universality. So the provinces, they can't charge patients user fees for medically insured care, and they can't permit private insurance for things that are publicly covered, right? So it's an agreement between provinces and the federal government for money in order to do universal healthcare for doctors and hospitals, right? So it doesn't cover long-term care, it doesn't cover prescription drugs, it doesn't cover dental care, it doesn't cover many of the things that have become increasingly important. And the other thing it only speaks to is payment for services, right? But not on what basis they're delivered. So the Canada Health Act doesn't say anything about taking public dollars and directing them towards for-profit companies to deliver publicly funded services. So when it comes specifically to Bill 7, as France said, it's a bill at its heart, when you get to it, is a coercive bill to coerce older adults in hospitals to accept long-term care placements that could, as Dr. Dupuis said, lead to further social isolation and is associated with a number of other really negative effects. So it's not covered under the Canada Health Act. That's also why, in my opening remarks, I said the thin edge of the wedge of privatization is using public dollars for for-profit delivery, because that's the part that's not covered by the Canada Health Act. It would be much harder, though not impossible, for the Ford government to push reforms that would also come very close and even cross the line on asking people to pay out of pocket for insured services. In fact, we're already seeing this kind of come very close and even, as I said, cross the line in certain areas. But that thin edge of the wedge are coercive things like Bill 7, but especially using public dollars to pay for for-profit delivery.
Okay, thank you very much, both of you. Just a note to the participants this evening, if you have other questions or comments that you want to have addressed by the panel, please make a note in the Q&A section of your screen. And I'm getting a steady stream here. We'd like to see more. Not that you've been shy so far, but just to make sure you keep asking. Next comment, and DJ and Kate, I'd like both of you to reply to this. We need to strengthen our home care options, but home care workers do not get the resources and training we need in our home care program. And I know one of the comments I get very frequently from constituents is they can't get the home care services they need. And many people would want to stay at home and be independent longer if they could get home care. Kate, do you want to start off on that? And DJ, will go to you after that.
No, absolutely. Folks, when you ask them, and that's what we should be doing, we should be asking people what they want to do. They will say they want to remain at home. Many individuals will have cognitive or physical medical challenges that make that more difficult. Something that isn't really being talked about as much, DJ, you did mention it, is like, what is the backdrop of why all this is happening? And, we did speak a little bit about, there have been a lot of cracks in the systems. For many years, the pandemic has really just pushed that to the forefront. It's pushed that to the forefront of a lot of people's awareness as well, because now it's happening to them. And a lot of times, folks maybe aren't paying as much attention until it starts to really impact them. And so when it comes to home care, for example, so staffers working in long-term care were given pandemic pay bumps. Folks working in home care systems weren't being given the same thing. Folks are going to go where they can make money. Inflation is rising, cost of living is incredibly high, gas, food, everything is soaring. We can't really fault people if the system is not supporting them to do the work that they want to do, and they need to seek financial compensation where they need it to be. So home care needs to be funded in a better way. We also need a lot more preventative, programming. So one of the things that we had highlighted strongly during the election was mental health. So in addition to pharmacare, dental care, most mental health care that is received in the province of Ontario must be paid for out of pocket. So that is something that is very expensive and a lot of folks aren't able to access. Mental health care can impact our physical health. Without our mental health, we do not have health. All of this will come together to impact our, sorry, I have a small person who's coming down the stairs to see me. Maybe DJ, can you take over for a second?
No problem. Thanks, Dr. Dupuis. And to echo a lot of the things I think what you're about to say, this just is another example of how the entire system works together. That home care, the way the Conservative governments moved it into the separate LHINs, unless all of the systems are working together, this is where you have the fall down. The way public health nurses and home care nurses have been starved for funding and the inability to provide that care. This is what leads people to, they have no choice but to leave the home and move into some of these long-term care facilities, which again, function mostly on profit, and they take away a lot of the key treatments and activities and everything that people trust on and rely on to have a fruitful life when they move to a long-term care facility. And this is one of the reasons why Iona has been pushing, and I know the NDP as well, have been pushing for standardized amounts of care to be provided to clients and residents every single day, not just tasks of getting up and getting them to the dining room and getting the meds, but to actually work with these folks with physio and activities and the rest to help provide a fruitful life.
Okay, DJ, thank you. Oh, France, did you want to speak to that as well, please?
Well, if you would allow me 2 minutes. The home care system cannot recruit and retain a stable workforce because the jobs that does not allow you to pay the rent and feed your kids. It's as simple as that. You could work like a 10-hour shift for home care, but you don't get paid for the travel between clients. In my neck of the woods, this is hours of care, hours of your time that you don't get paid for. You'll work 10 hours, you'll get paid for 7. And this could be fixed right now. The for-profit wants to make as much money off the back of those workers as they can. The government could mandate 70% of their workforce should be permanent, full-time, well-paid, with benefits, with sick days, maybe a pension plan, and tens of thousands of PSWs who are good at providing home care, who want to provide home care to the people who need it, would come back to their job. But right now, they make more money working at Tim Hortons than they do working a shift on home care. They come to me and say, I know that Mr. X needs me and there will be nobody else, but I need the money. My daughter needs new skates. My rent went up. They have no choice. That's because the for-profit home care company gets a ton of money, but they only give very little of it to the PSW who provides the care. All of this has to change.
Thank you. Something that I've actually been asked by reporters at Queen's Park when we've been doing scrums after question period is one that I'd like a few of you to address. Could someone address this issue that there's been an intentional strategy to starve the medical system so that there will be an ongoing crisis where staff and the public pay the price, which gives the right context to argue or promote privatization? A number of you may want to speak to that, but I'm going to start with you, France, because I've heard you speak to this one before. And then I'd like the rest of you, if you feel like it, to jump in on it. France, if you wouldn't mind starting off.
This is the arguments that was used by the last conservative government. They pointed at some weaknesses we had in our home care system to say the private system will do things better, faster, cheaper. Same thing with long-term care. And we saw the result. Now they are using the crisis that we have. We could help the crisis that we have. We could get rid of Bill 124. We could let nurses negotiate. We could recruit, retain, return, and respect our healthcare workers. But right now, they feel completely disrespected. They feel like there's so much violence at work. There's so much people that they just say, I can't take this anymore. I'm going to retire. I'm going to leave. I just, in order to be able to care for others, you have to care for yourself. And this is where our healthcare workers are at right now. So the government could do something. There are many things that they could do right now to help with the shortages of healthcare workers in every part of our healthcare system, but they refuse to do this. By refusing to do this, they let this crisis get worse and worse. And then people are saying, well, you know, I had to wait for 2 years to get my hip replaced. I had to wait for 36 hours in the emergency department. Yeah, maybe, you know, like, I would be willing to give a couple $100 to go to a private clinic so that I don't have to wait. And this is the argument that the conservative are using. You know, like the private sector will do things better, faster, cheaper. None of that is true. But they are building the case to bring it there. And if enough people get failed by the public healthcare system that we have now, those people will look at anything is better than what we have now. I cannot wait another 36 hours with my sick baby in an emergency before I am seen. Therefore, let's give that a shot. And then we're done.
Okay. DJ, you're nodding your head on this as well. If you wouldn't mind jumping in, and either Dan or Kate, if you have comments on this, I would be very pleased to hear them. But DJ, if you could.
Yeah, and thank you, Peter. And I'll agree with everything that France just said. I mean, we saw these comments come out from the previous health minister as she was, looking to move out of government, that, the solutions are there and they're private operators. Even today, Doug Ford said again, I'm no healthcare expert. I don't know. I'm trusting the experts. But unfortunately, the only experts they're talking to are the for-profit providers. And, I liken back to when they were making a vaccine program announcement, back in the middle of the pandemic. And who was standing behind the Minister of Health at the time was executives from Walmart and from the Weston family for Shoppers Drug Mart. I mean, this is the insidious slow creep of giving our healthcare system over to for-profit companies, which again are only focused on the profits, not necessarily the care. And then it gets bigger and bigger and bigger, that they're already talking about, surgeries that need to be done by for-profit clinics. But again, as France mentioned, we already have the infrastructure in place that sits idle throughout the night and on a number of weekends and holidays that very easily could be providing this care. I don't think there's anyone out there that needs cancer surgery or a hip or knee surgery that wouldn't want to have it done at 3 a.m. because they'd rather it done at 3 p.m. We already have the system there and in place. It's because this government has chosen to turn their back on it, that's why we're seeing privatization as the only solution, and it isn't.
Further comments?
Yeah, Peter, if I can jump in, I think there's a relevant myth here that needs to be busted, and that's the myth that we somehow overspend public dollars on our healthcare system. The reason why that's a myth is, if you actually look at the data, so historically, we spent about 70% of all healthcare dollars, or 70 cents of every dollar in this country publicly, and then about 30% or 30 cents privately. That's shifted a bit because of the pandemic. We've gotten a bit more public funding in the past year. But if you look at it from a historical sense, that's actually less than many, in fact, most of the countries that we compare ourselves against internationally. It's less than the United Kingdom. It's less than the Netherlands. It's less than Sweden. It's less than France. It's less than Germany. The list can go on and on. Yet we're faced all the time, right, with this talking point that somehow it's gobbling up government budgets. The problem is that the reason why there's a kernel of truth to that is our healthcare spending, public healthcare spending, though it's less than our international peers, and though it's remained relatively constant, government is collecting less and less money because the governments have engaged in a deliberate policy choice to cut taxes, corporate taxes, income taxes, create more tax loopholes for wealthy people in Ontario and across the country. And so, of course, you don't have to be a PhD in math to know that, your numerator's at the top, your denominator's at the bottom. If you decrease the size of the pie, then of course the healthcare piece is going to look bigger. So it's not true that healthcare spending is out of control. It is going up, but it is not out of control. And it is not true that when you compare Canada to other countries that we overspend publicly. That's just not what the data says.
Okay, thank you very much. I'd like to go to a question about the legality and fairness of moving people into long-term care homes they don't want to go into. But before I go there, France, you told an anecdote the other day to the media about a resident in your riding whose spouse was moved to a long-term care facility that was not accessible to that person. And it was an important story, I think, to illustrate the impact decision can have of moving someone to a long-term care facility that's inaccessible to their family, their essential caregivers, their loved ones. Could you give us that story? And then Kate, I'm going to want you to answer this question.
Absolutely. So I live in Northeastern Ontario. Our hospital, Health Sciences North, was in crisis, and they moved residents. They moved what they call alternate level care patients to long-term care home not of their choosing. I had over 200 cases of them in my office, of families who wanted their loved one to come back to where they live. There was one man his wife had been placed away from where he lived. He was quite elderly, and for 2 years, he called my office every single day, and he called the care coordinator at what was at the time the CCAC. Every single day he called. I went and met with the executive director, Richard Joly of the CCAC of the Northeast, and said, we have to do something. We have to bring this elderly woman back close to her husband. It took 2 years. We finally got her a spot close to her husband, and she died that day. They never got to hug one another. They never got to see one another, and it just broke my heart.
Yeah. It's a horrifying story, and I'm worried we'll hear many more like this. Kate, we have a question here. How can a system that proposes to forcibly move vulnerable elderly individuals into long-term care homes that are not of their choice and could be far away from their community, their family, how can that be legal? How can that be right?
I'm not a legal expert. I'll preface by saying that. But also, France, like, thank you for sharing that story. And that's something I'm very concerned about, because we heard during the pandemic, there was a family from the GTA whose family member was sent to the Ottawa region because the hospitals here during wave 3 were full, and their family member died. And then they were sent a bill from the Minister of Health to transport that person back. So I'm a little concerned that there's no discussion here about what happens. You know, the Premier's spokesperson yesterday said, oh, I use Google Maps. It's only like a 30-minute drive for a family member to visit a loved one. Many folks cannot drive. They do not have access to a car. Gas is very expensive. They work long hours. There's a lot of issues here, I think, that we need to work on. From the legal perspective, personally, I feel like a legal scholar would have to answer this, but if you listen to the Minister of Long-Term Care's answer related to this, his answer is, this has been happening. This has been happening in the system. This has been an opportunity in the system since 1979, that a hospital could simply say to someone, we must send you to this place because we need your acute care bed. If you do not want to go to that place, you must pay for your acute care bed. So I guess their answer could be, we're giving you the option. You're choosing not to pay for your bed. Therefore, if you are not paying for your bed, now you must leave your bed to someone else. And I presume if this has been something that's been available, I know this, we went through this with my own family member in Quebec. This was also an option that was given to us. If you want to stay here in the hospital, you can, you have to pay. This happens in other places. But why is this happening now in 2022? So, we have an ongoing pandemic. Twice as many people died last week as this same week in August 2021. Our percent positivity rates of our COVID in Ontario are like 4 times as high as they were when kids went back to school last year. So why this government is not addressing anything to do with, like, what are the actual, take a step back. Why is this happening now? Why is Bill 7 coming into place now? The government argues that the status quo is not working, but as others on the panel have so, eloquently said, the status quo is not working because solutions that are relatively simple, repeal Bill 124, stop artificially wage suppressing, hundreds of thousands of healthcare heroes, acknowledge the ongoing pandemic, and ensure that staff of hospitals and long-term care, who typically tend to be female, these are female-dominated industries, they tend to have children. My little person just came downstairs. He's going back to school next week. What's going to happen then? Why is there this staffing crisis in our hospital? And why have we gotten to a point where the only solution this government appears willing to take is the one where we are shifting people around a massive province? So, I do see there's a lot of questions around what can we do, and I think we'll get into that. But, it's also like, why is this happening now? What is the context of this moment? I think that's something really important for us. The government does not want us to ask this, I don't think, but I think it's a really important question for all of us to be thinking about as well.
Okay, thank you very much. I'm going to read one or two comments and then go back to questions. And just a reminder to all of you who are participating this evening, use the Q&A to post your comments or questions, and we'll try and get as many up as we can. Comment here, we all pay for OHIP through our Ontario taxes, as well as the federal Medicare funding, but not every Ontarian knows that. They need to know it. Comment, if anything, I feel we need to go into the opposite direction. National pharmacare, universal dental care, and physiotherapy. What's the point of a free doctor's visit when the treatment is out of reach? And another question actually requiring comment. Private long-term care homes motivated by profit seem more likely to pressure people to accept medical assistance in dying. Private hospitals would do the same. Please comment. Is there someone who would like to comment on that observation? No. Franz?
I will just say that to bring private hospital would be pretty tough. We have one active private hospital in Ontario, 4 altogether, 3 are just on paper. One, Shouldice, is still providing care with Medicare. With our hospitals are publicly delivering care, not privately. And I think to build a new for-profit hospital would be a whole lot more difficult. What we have in Ontario is independent health facility. This is the name that we give to private facility who offer some care, but they are not a hospital. They will offer cataract surgery. They will offer very specific procedures of testing for your heart or colonoscopy to see if you're at risk of colon cancer or things like this, but they are not a hospital. So I'm not too worried about having full-fledged private hospital pop up, but I am very worried about having private surgical suite where your surgery will be covered, but everything else won't be. And again, they will siphon resources, physician, nurses, etc., from our public system to go into those private clinics.
Okay, thank you. Another question here. Bill 7 violates Long-Term Care Homes Act and the Patient Bill of Rights. Actually, that's a question. Do they? Where is the Patient Ombudsman Office in all of this? Do any of you feel like taking that question on? Franz, I'll go to you.
I can give it a shot. The Patient Bill of Rights was modified by the previous Ford government in the previous session. And I guess they already knew that they were going to do this because it has been modified in a way where no, you're not modifying, you're not contrary to the Patient's Bill of Rights the way that it has been rewritten.
Thank you. DJ, you wanted to speak to that?
Yeah, thank you. And you know, we know there's always been pressure in the healthcare system, you know, to move people out of the acute centers that, you know, sometimes send them home with home care, you know, a little quicker than they want. We know these pressures have already been there, are always been there. A number of concerns that have come forward from our members in the last couple of days since Bill 7 has hit the media is, again, the lightning speed that the Ford government is pushing this through without adequate consultation. Informed consent is one of the cornerstones of healthcare delivery in our country and, you know, throughout the world. That, you know, if you're putting the pressure on these patients and to move out of the hospital into these long-term care facilities, this is only going to open our members up to complaints with our regulatory body. Have they overstepped? I mean, maybe even litigation. We don't need another reason to chase nurses, doctors, and healthcare providers out of the system. They've not checked all the boxes to make sure that they've looked at this properly and the devastating consequences that they could have by pushing Bill 7 through. They just haven't done the work.
Okay, thank you. I have a question for you, Dan. When we hear of hospitals shutting down certain services, how does that impact on healthcare professionals, starting with doctors and on to all staff?
Deeply. I mean, we're in this profession because we want to serve people, we want to help people. So when we're, working in services or taking care of patients who suddenly can't get the care they need, obviously that's a huge issue. We don't just care for individual patients, but we also care for communities that we're all, deeply invested in. And the other issue is it's not as if, if you close an emergency department or you shut down an MRI scanner because you're short on technologists, that the care needs go away. Of course, they're just going to come, people still get sick, right? But of course, you're just pushing things downstream. People are getting sicker. You're furthering delays in accessing care. And I just want to also emphasize that when this happens, it means things are really, really bad. Because healthcare workers, will go over and above, work extra hours, expose ourselves to moral injury, to literal physical injury, the way that DJ outlined. So the fact that we're reaching this point, I think is really significant. It is both the result of knock-on effects, and it will also generate further downstream effects. So this is of course a serious issue, and it's also not an inevitable issue. Nothing about the current situation was or is inevitable. It has been generated by policy choices, either deliberate or negligent, to not take the decisions to actually improve the system. We were hailed as healthcare heroes. People were, hitting pots and pans for us. And then when it actually came for the government to put put their foot down, put their money where their mouth was, where their pots and pans were, I'm not singing, a song for doctors. We're doing fine. We're well paid, but it is crushing, right? To see my colleagues in nursing, PSW, other professions who are they're really at the coalface of this moral injury and physical injury. And it is so frustrating and infuriating for us to see this happen to our colleagues. Many physicians, we have a degree of autonomy because most of the time we're not directly employed by hospitals. We have the ability to speak independently more. We face less repercussions because, we have all this social capital attached to us because we have the letters DR before our name. So I just really want to emphasize, how much we need to support our healthcare workers who are in the system, and how much the government is absolutely not doing that right now.
Thank you. DJ, did you want to speak to that as well? Because as nurses and healthcare workers really do get hit hard by these sorts of situations.
Yeah, and thank you. And thank you, Dr. Raza, for your comments and recognizing that it is truly a system that, that a lot of the legislations and policies do target, as Dr. Dupuis had mentioned, nurses and healthcare providers, which are mainly female dominated. And I know we see a lot of in the media that the shock of an ER or a part of a hospital closing for a couple of days, and that is terrible. To take that resource away from the community is gobsmacking. But what also is going on is what we're calling these silent closures, where you would normally have about 20 different RNs working in a busy emergency department overnight. Well, now there's 10, right? But the same number of patients and concerns and resources are needed to service the communities that they're in. Certainly up in Northern Ontario, where France is from, that you take those resources away. Now they're showing up and seeing a sign that, expect a 60-hour delay for emergency care. This is unsustainable. And, it's depriving people of the basic care that they need. And truly, as Dr. Raza was mentioning, most healthcare workers will take that burden upon themselves. They will extend themselves into an area. They're working without PPE in some areas. They're exposing themselves to injuries. And also the sheer frustration that the public is feeling and seeing and being involved in having to tap into a system like this, they often take out that frustration on the healthcare worker who happens to be the face right there in front of them. And as I touched on in my opening comments, the level of violence and harassment that nurses, physicians, everyone across the whole gamut in the healthcare system are facing on a day-to-day basis is really taking a toll on people.
Yeah, thank you very much for that. I just wanted to add myself that on the weekend, I was talking to a doctor who was working in a rural hospital in Southern Ontario, and she said one of the things that has been very difficult for them has been the ongoing threats of violence. And frankly, in the hospital she's working in, they're seeing Facebook postings of threats to violence to members of the staff in her hospital. And it's incredibly unnerving for them to have this sort of thing out there. And we don't have a program to deal with these threats that are really undermining our healthcare system. I'm going to go to next question I have. Why does the province not have to account for unspent dollars? For example, all the healthcare money given by the feds during COVID. Franz, did you want to speak to that? Because I know you were deeply involved in that.
Absolutely. I mean, the Financial Accountability Officer, as well as the Auditor General, made it very clear that $1.9 billion, that's with a B, of money received from the feds to help in Ontario was never spent. I can tell you that it could have been used many, many times over during the pandemic. DJ started, and so did Dr. Raza, by saying, repeal Bill 124, let the good people who have worked so hard in the last 2 years, give them back their right to bargain. I mean, nurses have always been very reasonable in bargaining. They are, give them back, show them a little bit of respect. But I can tell you that as the health critic, I do hold them accountable, but I would say very few people know that $1.9 billion was never spent. And when I can speak for Northern Ontario, we could have used that money in primary care. We could have used that money supporting people with mental health. We have an opioid epidemic where the rate of death from opioid overdose is 4 times higher where I live than in the rest of the province, which is already too high. But yet the government decided to sit on that money, make savings in a time where a lot of Ontarians were having a really tough time and would have needed access to our mental health system, to primary care, to every part of our healthcare system. That's the choice they made.
Thank you. We're shockingly enough starting to run low on time. I've got a comment here, and Kate, I'd like you to follow up on it. And that's that there are much better models of elder care in some European countries, especially Denmark. It would be good to study these and apply the same principles. I've heard the Netherlands has a team-based approach, so you don't get random people picking up shifts, but a team responsible for a specific group of patients. Could you speak to that and what we actually could be doing in Ontario to improve care, if we wanted to improve care?
Yeah, so I think there are definitely other models of care in long-term care, but also within hospitals. So, we have breastfeeding friendly hospitals so that when pregnant persons go into hospitals and have babies, there's a lot of support for them at the start of a person's life. We do not have senior friendly hospitals. We have hospitals where folks perhaps are alone a lot. They aren't necessarily, their delirium isn't necessarily been picked up on. They perhaps, don't have as much access to family and friends coming in as visitors. There's a lot of things we could do to make our hospitals more friendly, one could say, for an older population. Consistent staffing is something that has been tried in other countries. Australia, here in Canada, folks are doing that as well. Consistent staffing, of course, requires you to have full-time staff who are going to come in and essentially, instead of Mrs. Smith being seen by 3 or 4 PSWs during the week, there is 1 PSW assigned to them. And so there is more of a connection. It's more of a person-centered approach to care. That individual feels like they are in their home, right? Long-term care homes, we want them to feel like it is your own home. Long-term care homes are also experiencing massive staffing shortages. So lost in the discussion around Bill 7 from the government is, so we're having these staffing crises in our hospital, which we could potentially alleviate if we were to repeal Bill 124. We're going to take people from acute care beds and put them into long-term care. But I saw a comment in the question as well. How do we know that the long-term care homes themselves will have adequate staff to care for these folks? That question is not being answered by the government. So I think, not a lot of folks know what's going on. Not a lot of people know about Bill 7. We have a minister of long-term care. We know that this government does not take well to criticism. If you have an MPP who is within our own NDP MPP, you may want to write them a letter, but perhaps if you have a little bit of spare time, you could send an email, phone call, voicemail to our Minister of Long-Term Care, or to the Deputy Minister of Long-Term Care, or to the Minister of Long-Term Care's parliamentary assistant, and say, hey, I've been hearing about Bill 7. I'm really worried. I feel like this might take away autonomy. This might not be the best form of care for folks. This may not be something people consent to. There may be some coercion around here. So this may pass tomorrow. Peter is saying, we need to get loud, and we need to get as many folks as we can involved in this. And I feel personally, oftentimes, like, what can I do? I'm just one person. But I think the fact that so many folks are on this call and people are really engaged in this discussion, take this energy and reach out to other people and let them know as well. And reach out to this government, because this bill is, I think, being pushed through, and the language they're using, oh, we're just tackling the status quo, oh, we're just providing innovative responses. The language they're using is deliberate, because they want you to think, as others have said, oh, I guess you're right. I guess, like, mom's been in that bed for 2 weeks. Oh, okay, sure. I guess we should send her somewhere else. This shouldn't be happening to folks here, right? So how do we get loud is by connecting with our government and saying, we don't like this idea. We don't like Bill 7.
This is a really good lead in. In the 20 minutes we have left, I think a lot of our focus has to be on, so what do we do now? Here's a statement and a question. I'm a senior. I feel singled out by Bill 7, that if hospitalized, I have lost my rights to choose how and where I may receive ongoing treatment. How can I let my anger at this clear discrimination of older people as a group be expressed in an effective way? Will there be a class action lawsuit that would speak to the unconstitutionality of Bill 7? I think that opens a pretty broad range of discussion as to how people can push back and fight back on this. I'm open to whichever of you want to speak first. Franz, I'll let you get the first shot, and then we'll go around.
I would tell everybody online that we live in a democracy. You are allowed to let your view be known, whether you agree with the government or, on this point where you completely disagree, to connect with the government. Dr. Dupuis has already mentioned, pick up the phone and phone your MPP, write an email, and send it and copy me. I would be more than happy to go and talk to the minister about the email that you sent him, or send a letter and copy me, or sign a petition, or ask for an in-person meeting with your own MPP. Talk to your family and friends about it, so that more and more people know and more people become vocal. In a democracy, the more people come under the same tent and ask for the same thing, speak with one voice, the more chances that we get heard and things change for the better. Don't give up. I know that tonight we focused on huge failings that needs to be addressed, but I have faith in the people of Ontario. We will stand up. We will speak up. We will defend frail elderly people, because what is happening with Bill 7 is not right. We know that it's not right. We're better than this. We can change things. In order to change things, we have to be loud. We have to speak up. And if every one of us speak up a little bit, it will become loud. We will be heard. I just don't know when, It will happen, but it will happen. They will change their mind.
Thank you. Danyaal, did you want to speak to this?
Yeah, I mean, I think France and others have spoke so clearly to Bill 7 and the serious concerns around that. I think maybe what I can speak to a little bit is the issue of the public dollars for for-profit services, including surgical care. You know, this is not, as I said earlier, inevitable. We actually have public solutions to these problems. Many hospitals have already started to set up community surgical centers where they're doing, ambulatory or day surgeries, less complex surgeries outside of hospital. And the big advantage of going that route, a satellite site of a hospital, is it's a place for hospital staff to cycle in and out of. It provides a break for hospital staff so that they can come back to the trauma centers or the emergency departments, less burnt out. It doesn't cherry pick staff away. It also uses hospital infection control protocols, and it's all based in our public hospitals, and it's putting patients first, not investors first. And the government can make the decision to direct public dollars this way, not for-profit surgical centers. So this is not the only way to do it. So we need to also speak about these public solutions, these not-for-profit solutions. And the other thing is, this is an example of innovation within our public system. I've been very lucky to, as part of my family practice, I'm a family doctor, use virtual care that's not operated by one of the largest telecommunications companies in the country, or owned by the Weston families, or invested in by the Weston families. It's integrated into my practice. I use it to communicate with specialists. I'm very lucky. There's just one project that we have here in Ontario where instead of me faxing a referral to a specialist, the patient waiting months to get an opinion, I can send, an online report to the specialist, and I get answers within 48 hours. More often than not, I deliver the care to the patient in my clinic in an environment the patient knows. This is incredibly innovative. It's an entirely publicly funded program. It's used in family medicine, not in walk-in care. And we need more of this. Our system is incredibly innovative, but if it's not supported by government, then we will continue to be a land of pilot projects. The public system is innovative. Innovation is not synonymous with the private sector, and we need the support in the system to actually spread and scale some of these innovations.
Okay, thank you. DJ, did you want to speak to this?
Yeah, thank you. And I'll just add on what's been touched on already, that this is the time to get loud. I mean, don't wait until you need to access the healthcare system to show up and realize what's actually been done to it. Reach out to your MPP, let your voice be heard. They are accountable. The government of the day is accountable to listen to us and take your concerns under advisement. Push the government to deal with, the panelists that are here tonight. We have solutions, we have options that can be explored. Force them to listen to people. Let's not just wait until 4 years from now when we're going back to the ballot box to raise our concerns at that point. This is the sort of issue that needs to be talked about in every Ontario household. This is a kitchen table issue. We need to be talking about this. Do you realize what's going on in the system? And do you realize what our friends and neighbors are going through? That comment from the senior that felt, they're not going to have options anymore. This is the same rhetoric the Conservatives and the Republicans used in the States, that there'll be death panels taking away your options and all the rest. I mean, they all read from the same playbook. We can do better. We need to force the government to do better. Let your voice be heard. Email, phone them, sign a petition that's going around. This is the time to act.
Okay, thank you. Kate, you had posted an interesting link to a list of decision makers in the government that is going to be made available to people. Do you want to speak about that?
Well, I just think phone calls, I don't necessarily know if all of the calls are transcribed, but phone calls in this government are absolutely logged. And we can see with some behavior from certain newspaper columnists over the weekend and some pushback against predominantly females, quite outspoken females who have advocated for healthcare and long-term care in Ontario, that this government does pay attention when there is public pushback. And, you know, I think we are all aging. We hopefully will all be blessed with a very long lifespan. And what happens now in Ontario will impact ourselves, our loved ones, our friends, our families, our neighbors. This could happen to anyone. The other really key piece about Bill 7 is we've been focusing a lot on older adults, but Cynthia Mulligan had posted something very interesting that was saying, really, this conversation is only about approximately a third of the ALC beds would be older people going to long-term care. No one's really talking about what would happen to the other almost 4,000 people. There is a whole host of individuals in our province whose voices are not being heard, and they aren't necessarily able to push back in the way that perhaps many of us on the call are able. Maybe we have the time, the capacity, the know-how, good internet that's not owned by certain organizations. You know, we can attempt to push back. I've also, with a physician up in Waterloo, we've been doing something called Phone Forward Fridays. So they're doing this in Nova Scotia. It's called, they do Tell Tim Tuesdays. So they call their premier on Tuesdays. We started that last week. We were asking for boosters for young kids. This week it's going to be focused on Bill 7. Even if Bill 7 has already passed, it's an important opportunity. You can always call the premier's office. Their customer service representatives are very kind. You know, you can have your say. And, you know, I think it's, you know, as DJ said as well, you know, talk to folks about what's going on. And it's easy to feel like, well, it's just going to pass. What are we going to do? But you can always change legislation once it's been passed. And this government, we know, you know, from a long history with this particular family here in Ontario, in Toronto, where I live, they really don't like negative publicity. And, you know, a story like France shared with us of this family, if this bill passes and folks are starting to be shipped around Ontario, we're going to start to hear these types of stories. And they are going to be tragic stories. And it will be up to all of us to amplify these and to say, hey, like my mom's friend just got sent, you know, to Pickering, and her kids can't go visit her because they have to do pickup and daycare and everything. And now they can't see their mom. So amplifying these questions. And the last thing I would say, you know, is in my own household, I feel like right now masking, personally, I'm not a medical doctor, but masking for me is like almost a form of civil disobedience because this government has told us the pandemic is over. They say everything's fine back to normal, but why are all these staffing shortages happening? Why are we hearing of hospital units closing or having silent closures? It's summer. Why are so many people we know right now are sick with COVID? So I'm wearing my mask. I'm as vaccinated as I can possibly be. You know, trying to take that one small step for you also helps to protect yourself, your loved ones, and your community. So, and again, not providing any sort of medical advice, but just, you know, if it's like, what can I do? Making sure you're up to date with those types of things, and that, you know, you're just trying to be as safe as possible when you're out and about, so that we can all contribute to supporting our, not just by our pots and pans, but to actually supporting our healthcare heroes however we can.
Okay. I'm going to take the opportunity before we have wrap-up comments to also talk to this issue. Kate, you were totally right. We need to be on the lookout for examples that we can bring into the legislature. I should tell people every day in question period, we've been putting questions to the government. We get about 9 questions. 6 out of the 9 regularly are about this issue. And we've been featuring the information, the stories that people have passed on to us, which have been very powerful and frankly have been picked up by the media and have undermined the government's position. So if you actually have a friend or family member who's in a hospital and receives one of these multi-$1,000 bills, invoices, please get in touch with us as the opposition so that we can raise this in the House and make the media aware of it. I'd also like to say that it's quite correct that phoning and constant phoning is a very useful tool. But if you're a member of a tenants association or a neighborhood association, of a union, a professional association, if you're a member of a large family, get each of those entities to send a letter to the government saying back off. I get a lot of individual letters, but I rarely get letters signed by 5 or 6 members of a family. I think having letters come in like that are an indication to the government of a level of mobilization that they may not have seen before. And I also want to ask people to attend the legislature. At some point, people may decide to mobilize a very large demonstration, but I want to say now, the Ontario Nurses Association has been excellent at having people come during question period, be introduced at the beginning of question period to witness what's going on. Everyone knows they're not there just to look at the fashion amongst the MPPs. Anyone who's seen this as a group knows that fashion advice is pretty thin on the ground there. So they're there because of the medical questions. And if you out there watching this decide to come down to the legislature, I'm very happy to introduce you and say we have a group from, and I'll just pick 100 Unity Road, a seniors building in my riding. We have seniors from 100 Unity Road, and they're here concerned about healthcare. They're concerned about Bill 7, and I'll name each one of you if you want. The government needs to know this is being watched. And I think it's quite correct that they're hoping it's August and the news will just blow past. But I think the harm that's going to be done to people guarantees that this issue is not simply going to slip away in the night. Too many people are going to be hurt. It is going to be visible. With that, we have about 5 minutes. If I could have a minute wrap-up comment from each of the panelists, and then we will put things to bed for the night. Kate, I'm going to start with you and just go around.
I just want to thank everyone for your comments and Peter for organizing this. I think it's a really important issue. DJ, I love the way that you described it as a kitchen table issue. We all know someone who's older. I work in this space. I teach in this space, and people deserve to age in place with dignity in the community that they've chosen. And that's something that I fervently believe. And this particular bill might take away folks, their opportunity to do that and to connect with loved ones. And I'm really pleased at how many folks have come onto the call tonight. And I just urge you, in any way you can, if you just have even a moment to chat with a friend about this, please just try and raise awareness about this bill. And please do, whatever you can to keep yourselves and your family safe. And thanks so much for coming out.
Thank you very much. Franz?
Same. Thank you to everybody who took the time to listen in, to send your questions, to be part of this conversation regarding Bill 7. I would say frail elderly people deserve respect just as much as every other human being deserves respect. And right now, the government is taking away some of their basic right, in part because they are voiceless, in part because they are being discriminated against. I have very hard time putting up with this. Everybody deserves respect. I don't care how old you are. I don't care how frail. I don't care how many diagnoses you are. You are a human being. You deserve to be respected. This bill does not respect frail elderly people. It has to go. And I'm hopeful that together and bringing more and more people to speak up, we will win. We will give them back the respect that we all deserve.
Thank you very much. Danyaal.
Nothing, as I've said before, and I will say until I am blue in the face, nothing about this crisis is or was inevitable. And we are at a moment in time, we are at a crossroads where we can either allow the government to hand over our healthcare system to pandemic profiteers, or stand up and demand a high quality, publicly funded, not-for-profit system that puts patients first and not shareholders. We can't allow a government that is willing to cede our healthcare system to the market, right, to break our resolve to actually build something better. And that's the spirit in which I'm going to continue to engage in my work as a family doctor seeing patients, in my work as a advocate and activist. And that would be my call to action to everyone here who has decided to dedicate 90 minutes in their evening, which is no small ask. And I'm going to ask you to dedicate a little bit more time in your phone calls, in your community associations, in your neighborhood groups, to demand a system that works for everyone.
Thank you very much. DJ.
Thank you. And, the joys of going last, because I know a lot of what I was going to say has been covered. But yeah, I'm certainly not giving up hope. When we lose hope, we lose everything. There is a better way. People are entitled to be treated with care and dignity and respect. And nothing, as Dr. Raza has mentioned here, was inevitable. There are better solutions. Take that time, and the over 100 people that took the time to listen to us tonight, thank you, thank you, thank you. But do that extra step. Write your MPP, email, engage with other like-minded groups. We hear over and over again, healthcare in our Canadian healthcare system, we wear it like a badge of honor. Let's not let it be destroyed under this provincial government. Reach out to those who think the same as you, and there is strength in numbers. Write your local paper. As Dr. Dupuis mentioned, this government really hates bad publicity. So if we can keep getting loud and get the word out there, we can make it better. He may win this little fight in pushing this bill through today, but we will win the war. Don't give up hope. There is a better way to do this.
Thank you. Panelists, you've been fabulous. It was a really good night. I want to thank my staff, Rob Kaufman, Louise Moran, Elaine Perkins, who did all the work to make things possible this evening. So to the three of you, a great debt of gratitude. To all of you who participated this evening, thanks so much. Excellent questions and observations. It led to, I think, a really lively interchange. And I want to say as well, this is not a sprint. This is a long distance battle that we're engaged in. We can win this one. Governments have been forced back before. This is a critical issue for us. It's a critical issue for people who want to be able to get good healthcare and who want their rights respected. We're not going to give up. It's a fight that we're going to continue. And I know that you out there are ready to continue it as well. Thank you, everyone. Have a good evening. Take care.